on Health and Family Services. Can everyone hear me? Okay. As a reminder, due to the continuing issues related to the COVID-19, we have new meeting protocols in place for the 2021 regular session. Remote access is allowed to all meetings for the interim. Members were provided a Zoom link to the meeting to access the meeting remotely. The meeting materials were put online early this week and made available for downloading. At this time, we'll have the Secretary call the roll.
Representative Bowling.
Present in my office.
Thank you. Representative Frazier. Representative Gibbons-Prunty.
Here in the room.
Representative Sheldon.
Here.
Representative Weber.
Present.
Representative Westrom. Representative Wilner.
Here in my office.
Thank you. Representative Petrie. Representative Reed. Representative Mosier.
I'm here in my office.
Thank you. Chair Bentley.
Here in the room. Everyone is learning really well because I forgot to read either present in the room or remote from office. So everybody's doing well with that now. So this morning we're going to hear from representatives with the Children's Alliance and the RAINEY ESTEP homes. They will be providing information on child caring and child placing agencies. Members, hold your questions till after the presentations, please. And we'll start, if you introduce yourself for the record, and Michelle, you'll be first with Children's Alliance.
Thank you, Chairman Bentley and members of the committee.
Get to your microphone
louder.
better. Yeah.
It's on. Hello. Can you hear me now?
Nope.
It's not on?
Is your button on?
Button's on, green light's on.
Just push it closer to you. There you go.
You got it? I'm Michelle Sanborn. I'm the president of Children's Alliance here in Frankfort, Kentucky. And I know most of you know me. And you know I've been with the Children's Alliance about 15 years. So you know that we're working from a continuation budget and we're working in a short session. So you're probably asking, well, why is she here talking about 2 budget needs for child welfare? And I'm here because the status quo and the continuation is not working. It's not effective. I don't know if you saw the headline in Courier Journal yesterday, but Kentucky leads the nation. For the 3rd year in a row, it says, in child abuse and neglect. And so we need to really look at what we're doing. And so I just felt really compelled to talk to you about 2 budget items that are very important to our child welfare system. The first request is about child caring facilities. And when you hear child caring facilities, I know some of you, we were talking earlier, you think of daycare centers, but we're not talking about daycare centers. We're talking about residential treatment facilities that provide treatment for our children in out-of-home care, our foster care system, and they're 24/7 facilities. There's regulations, staffing, licensing, accreditation, et cetera, that goes with these agencies for them to provide this service. It's a mandatory service. We have to provide the treatment services for the children in our out-of-home care system. So if our agencies don't provide this system, then the state has to provide the system. And KRS 199-641, it says when the department chooses to contract with child caring and placing agencies for children committed to the state in their custody, that they shall make payments to that facility based on the rate-setting methodology developed from the model program cost analysis. So it's a lot. It's like, what's the model program cost analysis? The model program cost analysis is basically a compilation of cost reports and time studies and other fiscal information that the department requires for all child caring facilities to complete annually and provide. And they take all that information and they come up with what we call the state median rate, the state median cost. And when you look at the 2018 cost report, that's the latest data we have. So it's based on really 2017-18 numbers. Child caring facilities were underfunded over $14 million. That's total. It's all allowable cost. But based on KRS 199-641, the state is only required to reimburse agencies the median rate. And so that would be about $9.5 million is what the state would need to increase residential reimbursement rates. And because their rate is made up of both state and federal funds, you're looking at about 6.6 state general fund budget ask, because we would draw down that other, it's about 30%, okay? So when we're looking at this model program cost analysis and we look at the law, I would say that Senator Buford and Senator Long, who wrote the law that put this model program cost analysis in, was Senate Bill, I think, 186 back in 2000. I am assuming when they worked with those private agencies and they worked with the state, they thought we would follow the law. And so that they didn't really probably envision me 20 years later sitting here saying, why aren't we following the law? Why are we not funding these folks at the median rate? And frankly, I've only been here 15 years. So if I would have been here 20 years ago when they wrote Senate Bill 186, I would have been arguing we should be covering the full cost of the care of the kids in our custody for these agencies. But that was the decision made back then. That was the discussions and I'm sure committee meetings back in that time. So we're looking at just funding the median rate. And I think if we're asking agencies to follow the law, we should be following the law as the state. So we're requesting that $6.6 million for residential. So the second part of our request is really the part that I think we really need to adhere to in regards to the fiscal impact to our state. But then also, we have Ginny Anderson and Marie Lyles Bates with us today to talk about the impact on our children and families. So the second request is talking about prevention services and prevention dollars that are desperately needed in our state. One of the reasons why it's important today for us to talk about prevention services is because in 2018 there was a new law passed, Family First Prevention and Services Act. We call it the Family First Act. Many of you have heard about it. We're working on rolling it out. But that was a significant law, that federal law that was passed, because it allowed for the first time ever, there was really two main parts to that bill, and it allowed for the first time ever for states to draw down federal match for prevention services. So really, the state really couldn't get involved a lot of times and really only had the resources for those kids that we served in foster care. But now the states have opportunities to draw down some federal dollars for prevention services that we're doing. So right now is the time for us to start going, how can we invest and change the system and move to what I would call the front end, okay? When you hear me talk front end, that's prevention. It's services to children and families to keep them from coming into our foster care system. The other part of the Family First Act is really an oversight and requirement, maybe increased restrictions, I would say, when they developed what they called qualified residential treatment programs. And what the Congress was really trying to do with this second part is they wanted to make sure that only kids that needed treatment went to our congregate care and residential treatment facilities, those child care facilities that I was talking about. So kids now have to be assessed, and residential treatment facilities are being asked to provide more treatment and have different staffing to only provide those kids the treatment they need so they can get back to family settings. So again, two main parts. But I will say, while we're talking about Family First, because for me, Family First is most significant because of the prevention services. But the qualified residential treatment programs are our current residential programs that are now being asked to do more, but again, not being reimbursed. So again, that goes back to our first request. But let's look at the prevention side. The request is for $20 million one-time funds to be used for our Family First prevention programs. And right now in the state of Kentucky, we have 3 different types of programs. We have family preservation, we have KSTEP, or Kentucky Strengthening Ties and Empowering Parents, and we've got the START program, Sobriety, Treatment, and Recovery Team. And all 3 of these different components are services to keep kids from coming into our out-of-home care system, okay? Each program is designed to serve different children, different ages, and different criteria. KSTEP and START especially are serving those families and children where drugs and alcohol may be an issue. And so those are 2 really important services that we'll talk about. So we look at family preservation in 2019 in Kentucky. These are from their own reports, our own reports, because Kentucky, when I say the state, I'm talking about all of us, okay? We spent $476 million on out-of-home care. Foster care system is costing that. But we only invested $18 million in the front-end prevention services. And those prevention services that we did invest in, it's a small amount, but they were successful at keeping children in their homes and communities at time of discharge 96% of the time. So it's working, right? They're effective, 96%. And then you look at the spending, and these reports will say that we're spending about $6,000 per family, but yet we're spending about $51,000 per child if we're removing them into out-of-home care. And again, these are averages. Some we're going to spend more, some we're going to spend less on both of those numbers, right? So these are numbers that we're doing right now. This is 19 numbers, so that was just a year ago, right? These are our numbers. So I wanted to make sure that we could really visualize, because I'm a visual learner, right? I'm a teacher too. I teach at Western Kentucky University. So I like to have this PowerPoint and these charts in front of me so I can see. Because I think to myself, you hear those numbers and you're like, wow, we really need to be flipping that system, right? We really need to be spending more on front end. Well, here's just an example of 100 kids. I just said, let's take 100 kids. And I even said, let's say it costs a $6,000 per child and not family. And we know it's family, but I don't have the exact number per child, and I wanted to compare apples to apples. So I put per child, and we're spending $51,000 on per child for a child served in out-of-home care. So if you look at that, we're $5 million on 100 kids, when we could really just spend $600,000 on that same 100 kids to serve them in their communities and with their families. So it's like, why are we doing that? And then I say, well, what about the success? The report says we're successful 96% of the time. But I'm conservative and say, if we're going to look at this budget, let's just say, what if family preservation is only successful 90% of the time? So we serve those 100 kids and families, and 10 of those kids, it just didn't work out. We still had to serve them in out-of-home care. So you've got to include that cost. You're looking at, again, $1 million, which is savings of 3.9 for 100 kids. Think of the difference we could make. And then if you look at the 19 report for FPP, where I pulled some of that data from the previous screen, they said that they served 5,122 kids that were at risk of removal. And that report says that they were successful 96% of the time. So if you do the math, we saved the state $220 million. And we kept close to 5,000 kids from coming into out-of-home care, being removed from their families and removed from their communities and their schools, and a lot of times, right? So for me, I just feel like it's so important when we hear about a budget where there may be money for the rainy day fund. Why aren't we funding our obligations before we do that? When I hear about a budget where there's one-time monies, I think to myself, why would we not invest to try to flip this system? We know there's always going to be a need always going to be need for kids to come into out-of-home care. So we have to make sure that we have that system. But why can we not serve another 5,000, 2,000, 3,000 kids in the front end and save money? So my request to you all is to fund $20 million, which will double the amount of services. If we really want to change the course of our child welfare system, we've got to invest this. It's one-time money. Then it could be sustained on the savings plus by looking if we can keep kids from coming in out-of-home care. And the hard part about this is we have to keep funding the 9,000 kids we have in out-of-home care. So if we don't have this kind of one-time infusement, we can't kind of stop the floodgates, right? Because we're obligated to serve this group right here. So we have to infuse this money in order to kind of stop the floodgates and try to keep that number down. So I've told you a little bit about the numbers and the facts of this. But what I really want you to do is to hear from Jenny Anderson and Marie Lyles Bates from RAINEY ESTEP Homes, so they can share a little bit about the K-STEP program and how it impacts their budgets and their families that they're serving.
I want to interrupt you right now. Realize that we clean these rooms between meetings, so you got about 20 or 25 minutes. Okay?
Okay. I won't take a whole lot of your time. I don't really know how I go after Michelle and her passion. I want to talk to, my name's Jenny Anderson. I'm the CEO at RAINEY ESTEP Homes. I've been with RAINEY ESTEP for around 20 years, working with kids in out-of-home care, in residential treatment, foster care, and most recently in the last 5 years, doing outpatient behavioral health and prevention programming. And our prevention program, our K-STEP program, has really changed the face of RAINEY ESTEP. Our goals, our mission on what we're doing. Traditionally, we worked with kids when they came into care, into residential treatment. Now our focus is keeping kids out of care and serving kids where they need to be served. I want to talk about our K-STEP program. It's one of the prevention programs that Michelle had mentioned. K-STEP stands for Kentucky Strengthening Ties and Empowering Parents, and that is exactly what the program does. Back in 2016, DCBS saw a rise in kids coming into care because of one or both parents' substance abuse, placing the kids at risk. So they came together with community partners, with us and KVC, another community partner that offers the service. We collaborated, and in 2017, we started the K-STEP program. What K-STEP does is it ensures quick access to treatment for families and in-home services, intensive in-home services. It addresses parental substance abuse, the substance abuse that's placing the child at risk that's in the home. DCBS will refer a child to us if there's a child in the home that's 9 years old or under, if the substance abuse that's happening with the parents is the primary factor of them getting ready to remove the child out of the home, and that the family, it's an investigative case, it's not an ongoing case that they've been working with. And then ultimately, after they do the investigation, if they see that it's going to be opened for an ongoing case because of the risk of safety for the child. The ultimate goal when we started K-STEP was to reduce the number of kids that were coming into out-of-home care because of substance abuse in the family. And so we wanted to do something creative, something that we were able to integrate with child welfare practice, substance abuse treatment for the family, and also family preservation. Not remove the child and ask the family to go get treatment, but also that family preservation where we're keeping the child there, we're bringing in a sober caregiver if there isn't already one there, and we are ensuring quick access to treatment for those families. The goals, the number one goal was to be able to keep the children in the home and the family intact, but the child in the home safely. We want to make sure that if the child does go into out-of-home care, that they come back quicker and at higher rates. There's lots of times once a child enters in out-of-home care, a parent who feels like that's the straw that breaks the camel's back, they're done, they don't know what to do next. So we really want to work with that family so that we can get them home quicker and that we can get them home, period. We want to decrease repeat maltreatment and have fewer kids enter out-of-home care. So we started K-STEP in July of 2017 in Carter and Greenup County initially, in the northeastern region. In 2019, we added Lewis County to that mix. From July of 2017 to March of 2020, we served 240 families in those 3 counties. Out of those 240 families, there was 443 children that we worked with in those homes. And out of those 443 children, we were able to keep 94% of those kids in the home intact with their families while the family received the treatment. That's 416 of those 443 kids. So when you look at that in dollars, and so we served those 443 kids, but 27 of them did end up in out-of-home care. But with the 94% success rate, we were able to save the state $19 million, which is, it would have cost the state $22 million if we brought those kids into out-of-home care, which on average, they stay for a year away from their families. And so I brought Marie Lyles Bates with me today. She, a few years ago, I would have introduced her as one of our K-STEP clients, but today I'm introducing her as a colleague and a coworker. She is a peer support specialist, and she's making one of the biggest impacts we are on the families that we're working with.
Thank you, Jenny. I am here today to talk about...
Introduce yourself, too.
Oh, I'm sorry. Marie Lyles. I am a senior peer support specialist at RAINEY ESTEP. I'm here today to talk about the impact of prevention programs. So, I'm not trained in public speaking, but I'm here today because it's important. I suffered with substance abuse for the better part of 20 years. We sought help in many places. Nowhere ever offered A, people that wanted to help, and B, people that were able to help. So I had several attempts and fails at that. In 2017, December, I was introduced to the K-STEP program. They were in my home within 24 hours. I can't imagine had I been removed from my children. I feel like all hope would have been lost at that point. They appointed my dad as a supervisor. So I was able to have access to my children as I did treatment. I completed IOP, volunteered for a while, and was eventually hired on. This is horrible in Kentucky. It's a vicious cycle. There's no way out. K-STEP offered programs like anger management, budgeting, parenting, things I wasn't offered before, along with, keeping the children accessible. I can't imagine what it would have done to them to have been removed. People are looking for a way out, and these prevention services are the answer. I was looking for a way out for a long time. I'm very grateful today. You can't put a price on keeping families together. And I was nervous about coming here today, of course, but like I said, this is important, and anything I can do to help, I'm willing to do. Today, I have a happy, healing family. I've been married 13 years. During the addiction, my parents couldn't help, my spouse couldn't help. My children, while they motivated me, it never worked. I have a 12-year-old little girl and a 7-year-old little boy. They're happy and healthy and healing today because of K-STEP. And I want to see more people have the opportunity to get the treatment that I got.
Thank you, Marie.
Well, thank you all you presenters. And I'm from Greenup County, so just feel relaxed here. Where are you from, Boyd or Greenup or Carter? Greenup?
Greenup,
Yeah, I went to Old McKell High School, so just calm down.
Okay. Yeah, my kids are at McKell now.
Yeah. Does anyone have any questions from the members? We have Representative Westrom.
I would just like to make a comment. Michelle, thank you for being here. You have certainly updated me. I used to be in the residential side of treatment, and our children, on average, at that time, had 27 placements before they came to Buckhorn Children's Home. And the Children's Alliance was a incredible organization that brought all of these nonprofits together. And you know, one thing we were always fighting for was adequate funding. And it seemed that the state just assumed that since we were nonprofits, we were doing incredible fundraising, and that's how we made up our deficit. It was very, very, very challenging, month by month by month. And now I hear that residential treatment and childcare has a different genesis. You know, with the onslaught of drug addictions and families being torn asunder, how brilliant for these child caring agencies to step up to the plate and help keep families together. I congratulate you and appreciate all of the work you do. Can you tell me how many children are in out-of-home placement at this time in the state?
We have about 9,200 or 9,100.
So that's
something.
gone down, hasn't it?
Oh yes. During COVID, we've gone down, and we were up to like over about 1,500 years ago in residential, and now I think we're down to 800, maybe
Wow.
even 700 kids.
So
in
they've had to
residential.
reinvent themselves.
So, oh yes, definitely. And our goal is to reduce the number of kids in out-of-home care. Again, we don't want to serve them in our residential facilities or even foster care if we can serve them in the home.
That's
which
right.
is
Work
really
with the
what- so
families.
it's really,
Yeah.
we want to flip that system. But while our agencies are being asked to do more for Family First, and they've been asked to do more, a whole lot more during COVID, they
I'm
need
sure.
the relief to maintain the services they're doing today. And then once we get through, today, by flipping our system, we probably won't be back asking for that anymore, right? We probably won't even need that model program cost analysis law, right? We probably won't even be talking about it because we'll be focused on this prevention side, which is really, it's good for families.
I just love
good
how
for our
you've
families.
reinvented. It's incredible.
It's what we want.
Thank you.
So, yeah, it's what we want. We want what's good for children and families,
Mm-hmm.
and it's fiscally sound.
Representative Western, you bring a lot of insight to this committee. I'm glad you're on it. Yeah. At this time, Representative Melinda Gibbons-Prunty would like to ask a question.
Thank you, Mr. Chair. And thank you for the information. I grew up in Ashland. Ramey Home used to be in Boyd County. Has it moved to Greenup County?
No, it's still in Boyd County.
It's still in
we
Boyd
also
County.
have offices in Carter County and Erlanger, Kentucky.
Okay. And my question is, you said you're not are you not getting paid at all? Or, I mean, you said you're not getting the median. Are you not getting paid at all? Or
Absolutely, they're getting paid today. That's just basically what their allowable costs would say that they should be getting, and what they're being reimbursed today. That $14 million is the what I would say the underfunding
Differential.
based on what the cost report says is their allowable cost and what their current reimbursement rate is today.
Okay. And then, may I have another question?
Yes, ma'am.
You said your numbers are down because of COVID. Do you expect a great increase once COVID is gone? I mean, that's my concern.
I mean, I expect there will be some increase when children get back into the community and into school. I do expect that. My hope would be that we could get family preservation going by that time, and we won't see that increase come back, and we can keep our numbers down. But I do expect us to have a surge probably in the fall once kids kind of get back out into the
Can I have
community.
one more?
Yes, ma'am.
So what's keeping you from getting Family First going? What's the holdup?
So we are implementing, the state is implementing Family First.
Okay.
And basically what they're trying to do is to draw down based on these current programs. So we will be able to expand some based on Family First. This money, this one-time money, is enough to get us what I would call the sustaining change that needs to happen in child welfare to truly help us flip our funds, but flip our services. Because right now we're just dabbling with 5,000 kids, right? It's just dabble. we've got to serve another 5,000 kids to really start seeing that impact. We were, just a year ago, we were up to 10,000 kids in out-of-home care. So if the surge comes back and we're back next year, we're back at 10,000 kids, again, that is a strain on those kids and families, but it's a strain on our budget. So we've got to stop the floodgates from them coming in, and this is the way to do it.
Okay. Well, thank you so much. Your numbers speak for themselves. I will gladly advocate to the A&R chair and the committee, and thank you for your story and sharing it. Your family's beautiful, so thank you all for being here today. Thank you, Mr. Chair.
Any other questions in the room? Any remote questions? Representative Wilner, are you there?
I am. Thank you, Mr. Chairman, for calling on me. Thank you for bringing this presentation to us and to the presenters. That was a great presentation. I really appreciated the personal testimony, and I know that takes a lot of courage to come and tell your story, and it makes a difference, and so I just want to thank you for that. I want to thank you for all of you for the emphasis on prevention, how important that is, that it's a cost savings, it's better for families. There's so many good reasons. The research is so supportive of how important it is to keep families together whenever we can. So I want to just applaud that approach. I have a little bit of a specific question. One of the things that we hear, or I've heard quite a bit anecdotally, is when kids are placed in out-of-home care, many are referred for conversion therapy because there are so many LGBTQ kids who are kicked out of their homes and who are then subjected to conversion therapy. Are you aware, and that practice is not against the law, there's nothing in the law currently to prevent state funds from going to foster care agencies and other agencies that refer to those kinds of services. Is it something that's on your radar at all from where you sit? And are you aware of any mechanisms for tracking if we currently have state dollars going to agencies that refer or provide those kinds of treatments?
As far as RAINEY ESTEP goes, I had never heard of Kentucky using conversion therapy until it's been recently. I've read some articles in the paper. So at RAINEY ESTEP, we have never referred any children for conversion therapy, nor have I ever been asked as an administrator for that to happen. As far as other agencies in our area, I'm not aware, but I'm not even aware of anyone who provides that in the northeastern region.
That's great to hear. Thank you.
Mm-hmm. And Representative Wilner, as far as the Children's Alliance, our members, again, just like Jenny, they do not use conversion therapy in their practices. And frankly, I think we're rarely concerned when they were hearing that those practices were going on in our community.
Thank you. And again, it's such a risk for out-of-home placement, and it's something that I've only become aware of in the last couple of years as well. And hearing those stories, they've already been through the trauma of being removed from their families and everything that led up to that removal, and then to be subjected to these practices. Right. So again, thank you very much. It's a very powerful testimony.
Thank you.
Thank you, Dr. Wilner. Any other questions from remote? Well, I am impressed to see a presentation around here that had red ink on it. We don't see those very often, do we? So we're glad to see that. Thank you all for coming down this. I know you had to leave early this morning, and for your presentation. It'll make us more aware of what's going on, and congratulations on your K-STEP. I think you're being very successful with that, and keep an open line of communication with us.
Absolutely.
And I reckon the next item is adjournment. I have a motion and a second, and we are adjourned.
Thank you.